Felicia. I'm going to be your student nurse today. Can you tell me your name?
Silas O,
Can you tell me your date of birth?
12/04/1989.
Can you tell me where you are?
I'm at Conway Behavioral Health Hospital.
Can you tell me who the president is?
Joe Biden.
Can you tell me what you're in here for today?
I am here to get a full body assessment.
Great. Okay, so now we're going to start. So his eyes are symmetrical to the outer canvas of his eyes, of his auricles. I'm going to check your head. His head is normal cephalic. He has dreads which they mat together to form dreads. He has some dryness to his scalp. His hair is evenly distributed with no infestation present.
Damn.
Leave it down.
Yeah,
Okay, here you go.
that's so
I'm gonna check your eyes. So I see you wear glasses. Do you use it for daily use or do you daily use? Okay. Can you take your glasses off? Do you wear hearing aids or anything like that? Okay, great. His, can you go follow my pen? His eyes are, his pupils are equal round, reacting to the light and accommodated. Can you let me look in your nose? His nose is symmetrical with with pink and moist. Can you open your mouth? Can you stick your tongue out? Can you say ah? His uvula is midline with the presence of his tonsils. Can you show me your teeth? Are these your teeth? Can you open up? There are no decaying on the teeth. His teeth are white and shiny. Okay, I'm gonna check your ears. His ear on the left side is clear with no seroma. Right side clear with no seroma. Now I'm going to check your throat. His throat is midline with no deviation, no lumps or anything like that. Do you have any pain in your throat or anything like that when you swallow? Okay, I'm gonna check your carotid. 2+. 2+ on the right and 2+ on the left. I'm gonna check his temporal. 2+, equal and bilateral. Okay, so now I'm going to check your brachial pulses, okay? Brachial pulses, 2+, bilateral and equal. I'm gonna check your radial pulses. Keep it going a little bit. Okay. Two plus, equal and bilateral. So, as you put your glasses back on, I just remembered, I need to check your conjunctives. Can you pull them down? They are pink and moist with some redness on his sclera. Other than that, his scleras are clear. Okay? Now I need to check I'll do your cavity fill and then I'll check your heart and then I'll check your lungs, okay? Okay. Cap refill less than 2 seconds on the left hand. Cap refill less than 2 seconds on the right hand. Skin turgor less than 2 seconds. Skin is cool, brown. You cold? Yep. Yep, you're a little cool. Okay. Now I'm gonna check your heart sounds. Make sure that your heart is beating good. I'm gonna check underneath. Aortic. I'm gonna come around here. Pulmonary. I'm gonna go under. Hearts. Tricuspid. And now I'm gonna check the mitral in the apical pulse for 1 minute. $78. In all 5 lobes, I can hear S1 and S2. Now I'm going to check your lung sounds, okay? Can you take a deep breath in? Deep breath in. 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 So now I'm gonna check down here onto the side. Deep breath in. Deep breath in. And all lobes are clear, unlabored, with no adventitious breath sounds. Okay, so now I need to ask you, do you have any ostomy, any catheter use, anything like that? Do you have any problem with going to the restroom or anything like that? Okay, when was your last bowel movement? Okay. Okay, so the consistency was small, medium, large? Was it formed? Was it any odor, any foul odor? Okay. When you went to the restroom, did you have any pain, or can you tell me the color of the brown of your, okay, brown of your bowel movement or brown of your urine?
Oh, I thought you were talking about, sorry, the bowel movement was brown.
The bowel movement was
The
brown.
urine was clear.
And the urine was clear.
And that was about 3 hours ago.
And there was no odor, no cloudiness, or nothing like that. Okay, so now can I look at your stomach? Okay, so I see no scarring on the stomach. So now I'm gonna look, I just looked, so I'm gonna feel and make sure everything is good and everything is moving in there. So, when was the last time you ate?
About an hour and a half.
Okay. Active bowel sounds in all 4 quads. I'm gonna touch now. Does it hurt when I push on it? No tenderness or distended of the bowels or his abdominal area. Okay, you can pull it down now. So now let's do your range of motions. We're gonna do some active range of motions, see what you can do. Can you squeeze my 2 fingers? Can you push my hands down? Can you push them up? Okay, can you raise your arms up like this? Can you put them in front of you? Can you bring them all the way up? Okay, so if you do it like this, put your arms up, and then can you raise them up? Okay, good. Okay, so active range of motions. He doesn't have any edema in his upper extremity. Looks great. No edema in his hands. Okay, so now I'm gonna do your popliteal pulses in the back of your legs, okay? We're gonna check those, okay? I did do your cat refills, didn't I? I did check your fingers.
Yeah.
I know you don't know, but I remember touching your fingers. These is hard to find. Okay. 2 plus on your popliteal pulses, bilateral and equal. I'm gonna check your leg. You have a scarring right here, right? No edema in his lower extremity or upper calf extremity. So now I'm going to check your tibialis pulses. I say it wrong, but that's okay. It's your tibia pulses. That's behind your heel, closer to the back of your, right here. That's right there on the side. Here's the strong 2 plus bilateral. So now I'm gonna check your pulses on top of your feet. I'm gonna look at your feet, and then we're gonna do some range of motion, and then we'll be done. And you did say you have no you don't use anything outside of your normal stuff that you were born into this world with, right? Okay, I'm gonna take your socks off. You don't have to use any contacts or hearing aids. Okay. He has some dryness on his feet. It's okay. We're just gonna use some little lotion. Dryness on both right and left feet. Cat refill, less than 2 seconds on left foot. Less than 2 seconds on right foot. Now I'm gonna check your, these are strong. The dorsal pedis pulses are strong, 2 plus, equal and bilateral. I think I took this off this foot, right? Okay. No edema in his foot. Feet are cool. Okay, so now, can you push up on my hands? Can you push down? Okay. Can you bend your legs?
Same time?
Yeah.
Oh.
Then you just had them up. Okay, now can you stand up? Do you need any assistive devices to move around? Any assistive shoes or anything like that? Okay, can you step forward? Can you step back? Can you, let's make sure it's there, we don't want you to fall. Can you sit down? Okay, Mr. Salas, it looks like you are doing great. You are in great bill of health. Keep doing what you're doing, and thank you for coming.